Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. This is Patrick, your host, coming to you with another episode of the Dental Brief. Today, I'm pretty excited. We have a really unique spokesperson, employee with a really unique company and a unique product on the show today. So without further ado, Mike, say hello.
Hey, Patrick. How you doing? Good afternoon.
Doing fantastic. So glad to have you here. It's Mike Palahach. It's the correct way to pronounce your name, right?
Palahach. Yes, sir.
Yep. And you're with Neocis.
Yes, sir. I'm the director of clinical sales and clinical education here at Neocis.
Yeah, so this is fantastic. So I'm going to change our format just a little bit. I want to talk about Yomi, which we're going to get to in just a little bit. But Mike, you've got quite a bit of experience working in the dental industry. Tell me how you got into it and kind of what your career path has been to this date.
Absolutely. Yeah, I had a very fortunate opportunity to join a company called Biomet 3i, which was it's a dental implant company that was acquired by Zimmer Biomet. And so I was there for about 7 or 8 years, teaching dental surgeons how to expand their implant therapy as a way to treat patients. And I got exposed to Yomi very early on. Actually, one of my surgeons was actually performing some of the clinical trials when I stumbled into his office and I saw him placing implants with a robotic device. And let me tell you, Patrick, when I saw it, and this was back in 2011, before they had full FDA approval, I was absolutely enamored and hooked to the technology and kind of just kept in touch with them over the years, and then was able to join them as the first commercial hire back in 2017. Started off selling the device at an early stage, sold the first 20 systems out in the marketplace. And then, fast forward to now, we have a big commercial team full of clinical and capital and service individuals that we're breaching about 100 systems in just 4 short years. So it's been a wild ride, that's for sure.
So we're going to jump into this for those in our audience that don't know. When you do presentations and demonstrations about, we'll just call it Yomi for now. We'll let you explain in a little bit what it is. But it actually kind of happens in this cool, customized, almost like a motorhome, right? Bus?
I wouldn't call it a motorhome. I mean, it's definitely it's a bus, but it's sort of the short bus. If you know what I'm talking about from the high school days.
Sure.
And we've outfitted it sort of like a dental operatory inside with the robotic device set up how it would be set up in an operatory. And it allows surgeons and their team members to get a hands-on experience with the device, because as you alluded to, it's new, it's unique. There's never been anything like it before in the dental field. And for that reason, it's just something you have to get your hands on. And we let surgeons and their teammates actually drill with the robot and place implants on typodonts with that mobile demo bus.
Yeah, so let's just jump into let's just kind of unveil what we're talking about here. Tell me, what is Yomi? What does it do? What is it?
So the easy way to describe it is the world's first and only robotic assisted surgical platform for the dental field, right? But to really understand what Yomi does, kind of have to take you back to the beginning of digital workflow for dental implant therapy. We have a similar workflow, so I like to use that as sort of a quote unquote guide. But you take a CT scan of your patient, you upload it into the Yomi Plan software, you plan the implants just like you would for, let's say, like a plastic surgical guide. The difference is that the robotic device is the guide itself. So it assists the surgeons in placing the implants, drilling and placing the implants. And what's really cool about it is that it allows the surgeons to visualize their surgical site. There's no guide in place. And if they want to make any intraoperative adjustments, they can quickly go into the software, change their plan, for example, change the angulation of the implant, change the position, or change the depth of the implant fixture on the fly intraoperatively, and get very, very precise, accurate results with the robot assisting them.
So you have to see it to believe it, in my opinion, right? So I think some people can kind of imagine, and again, for those who haven't seen it, so let me just, anyone who's not driving their car right now, let's check out the website. It's neocis.com, correct? And that's neocis.com is the website, right?
Mm-hmm.
And Mike, they can go actually start to get a visual of what it looks like, and also get a visual of what this bus, the demonstrations are done.
Yeah, you can get sort of like a foundation of what the device looks like and what the workflow would be, either relative to what your workflow is or not. But it's definitely something you sort of have to get your hands on. I alluded to, like, the first time I saw a Tesla, or when I got into a Tesla and a friend of mine took his hands off the steering wheel. I had to see it to believe it. Very similar type of experience when you get your hands on the robot for the first time. But robots have existed in medicine for over 30 years. We're just sort of late, as most technology is, to the dental field. But it is one of the last specialties of medicine that doesn't have a robotic assisted surgical device. So it's very well placed in the medical field, with things, robots like the Da Vinci, and with the Mako surgical robot and the Mazor spine robot, for example. Just the first one in dental.
Yeah, and it does. It's interesting, because I was going to bring that up myself. For those that are not by a computer, not looking at this moment, or haven't had a chance to, that's exactly what I think of as Da Vinci. Right? And I also kind of think of, for those that are listening, going, "What, a robot that can place implants? That's insane." I also think, like, hey, what did orthopedic surgeons think, or what did any general surgeon think about Da Vinci just 25 or 30 years ago? Right? They probably thought, "Yeah, no way, not in a million years." So tell me, who's this right for? Is this oral surgeons? Is this perio? Like, who's this? Who's your biggest audience for this amazing device right now?
That's an interesting question, because in my opinion, it's a great device for anybody that's currently placing implants with any type of volume. When I say volume, anything over about 80 implants a year can really justify the purchase, right? But what it's really beneficial for are for clinicians that want to elevate and differentiate their practice, right? With a tool like this, it's hard to miss it in a market. We see that surgeons who adopt the technology are able to really expand the number of procedures that they can do, and the types of procedures that they may or may not be comfortable with if they were doing the procedures only freehand. So we feel that it's a device that's suitable for all specialties of dentistry.
Sure, that makes sense. So I know you probably, the FDA and what have you, you have to be kind of careful of what you say. But tell me, is this a device that can help? One, can it decrease failure rate? So let me start with that one, and then I'll follow up. Does it save time?
So let's start with the failure rate thing. And this I can help with my experience with dental implant sales, right? When an implant fails, a clinician reports it to the implant company, right? And that's usually when the implant fixture either needs to be removed, or whether it's failing and isn't integrating with the body. So it gets removed, it gets sent back to the implant company. Typically, the implant companies will warranty those implants, so it gets reported as a failure. That's one of the main reasons why the failure rates are so low. Implants are 95 to 98% successful in humans. That's because they're really only reported when they come out. Poorly placed implants, or implants that are difficult to restore, or that are placed too deep into the bone or not deep enough into the bone, typically those implants are never reported. Most of the time they're left in the patient's mouth, and they're, a restorative dentist might have to restore those implants in a difficult, challenging fashion. And when we think about what the robot helps the surgeons with, it's really with in regards to accuracy and precision. We're very confident in the robot's ability to drill and place implants with sub-millimeter accuracy. So if you plan an implant to be in a specific area, position, angulation, and depth, we're very confident that it can repeat very closely that plan. So, what are we trying to avoid? We're trying to avoid what we call no-fly zones. No-fly zones are nerves, the mental foramen, the mental nerve on the lower arch. We're trying to avoid drilling into the sinus. We're also trying to avoid drilling into adjacent teeth because those events can be detrimental to the patient. So the robot helps give surgeons confidence that they're going to be able to repeat what they planned in software.
Sure, that makes sense. So, Mike, let me ask you this: this demo that you guys do, I think, is fantastic. I don't know any company that's doing anything like this. So, kudos to that. That's great. If somebody's doing a significant amount of cases and they think, hey, yeah, I want to better my implant game, whether it's an oral surgeon or a general dentist or a super dentist, we'll call them. How do they get in touch with you guys? How do they set up a demonstration? Well,
you alluded to it earlier. The best way to get your hands on the robot is to go to our website and request a demonstration. We have a team of capital specialists that will speak to you and talk to you and ask you if you are a candidate. And if you are, we'll literally bring the robot to your practice. And I think we've gotten very creative with how we do that. We've been known to bring the robot bus to surgeons' homes, to restaurants. Doesn't really matter where it is, as long as a bus, short bus, can reach it. But sure. Mainly what we do is we bring it to the practice, park it out in the parking lot, and allow the surgeons of the practice and the team members to get their hands on it. That's the easiest way to get a demonstration. We're at a lot of the trade shows as well. So a lot of the oral surgery trade shows, a lot of the implant focused trade shows. AMIS Dental Implant Conference is coming up. The ICOI is coming up. AO next year, and trade shows like that. We have the robot on display and available for demonstration.
Mike, fascinating. It's fantastic. Again, I want to encourage our audience to check out the website, neocis.com. That's neocis.com. Mike, thanks so much for taking the time to be with us today. We really appreciate it.
Oh, we appreciate you. Thank you, Patrick. Thanks for the opportunity.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.